you see a sports medicine physician, we are familiar with all sorts of very common and less common sports. So for example, if you ride motocross or if you do combat sports, we're not necessarily going to tell you to stop your sport unless it's absolutely necessary. So for future patients, know that there's a way to get better without surgery. And even if you do need surgery, I think it's good that you see sports medicine. Sports medicine has two different subspecialties. One is the ones that do the operations, and ones are that don't do operations. The one I do is non-operative sports medicine, and this is basically where we help athletes get back to their usual state of function after an injury. We treat all sorts of injuries, mainly musculoskeletal, but we also deal with the medical problems of the athlete as well, such as asthma, concussions, and any other problems with the health of the athlete. RUHS is a safety net system. We are mainly taking care of a lot of vulnerable patients, and most of the time in sports medicine, you think of middle to high-income individuals. What sets us apart is that we can take care of underserved and vulnerable populations with the ability to basically get them back into their sport so that they can thrive just as well. Sports medicine really just started in the 90s with dedicated physicians that cared about the athletes, and they were on the sidelines. Over the years and decades, we have refined to focus more on specific areas of athletes where they get injured depending on their sport. We also have increasingly used the ultrasound technology to help us make decisions much quicker in the office instead of relying on advanced imaging with an MRI. Most of the time, if we need an MRI, we will know that much faster by using the ultrasound. I do enjoy teaching and treating patients. Those are the main two things about my job that I really enjoy. So my fellows, they spend 1 year with me, and I teach them all I can about sports medicine, and it's really rewarding to see them graduate and do great things after they're done training. Similarly, on the patient side, I really like seeing a patient from the beginning where they are dealing with a bad injury, and then we get them to the point where they don't need to see us again, and that's really rewarding for me.